Ophthalmology OSPE lecture. Chalazion. Chalazion is a chronic sterile lipogranuloma of meibomian gland. Stye. It is the acute suppurative infection of lash follicle and its associated glands of Zeiss and Moll. The difference in chalazion and stye is that chalazion present away from eyelid margin and stye at eyelid margin. Second, chalazion involve meibomian gland and stye involve gland of Zeiss and Moll. Trichiasis. It is the misdirection of eyelashes towards the globe. This is the picture of entropion. It is the condition in which eyelid margin is turned towards eyeball. Ectropion. It is the condition in which eyelid margin is everted away from eyeball. Ptosis of left eye. It is an abnormal drooping of the upper eyelid. OR. Abnormal low position of the upper eyelid. Basal cell carcinoma. It is the most common malignancy of the eyelid, accounting for 90% of all cases. It most frequently arises from the lower eyelid, followed by middle canthus, upper eyelid and lateral canthus. It is a slowly growing, locally invasive and non-metastasizing tumor. Left eye acute Dacrysis. It is acute inflammation of lacrimal sac. Swelling at the medial canthus, which is reddish and tender on touch. Regurgitation test is difficult to perform because of tenderness. Mucopurulent or purulent discharge may be present on the side of medial canthus. Abscess formation may occur in untreated cases. Conjunctivitis. It is the inflammation of conjunctiva. Viral follicular conjunctivitis. Follicle develop in tarsal or follicular conjunctiva. Ophthalmia neonatorum. It is conjunctival inflammation that occur within first month of life. Viral keratoconjunctivitis. It is recurrent bilateral allergic inflammation of conjunctiva. Cobblestone appearance or pavement stone on conjunctiva. Pterygium. It is a degenerative condition of the conjunctiva in which there is triangular fibrovascular connective tissue. Overgrowth from conjunctiva to the cornea in the interpalpebral region. Parts of pterygium. Pterygium consists of three parts: a cap and a vascular halo-like zone at the advancing age, a head, a body. Herpes simplex keratitis. Acute epithelial keratitis. Dendritic ulcer. Geographical ulcer. It is an acute or chronic corneal ulceration where an ulcer has a shape of linear branching tree, i.e. dendritic or geographical, amoeboid configuration. Etiology. It is caused by herpes simplex virus, both type 1 and type 2. Corneal staining with 2% fluorescein and rose bengal give bright green color of dendritic and geographical ulcer. Herpes zoster ophthalmicus. Herpes zoster ophthalmicus is an ocular and periocular disease due to the involvement of ophthalmic division of trigeminal nerve by herpes zoster virus. Hymen herpes virus, 3HHV3, is the causative agent. HHV3 causes two different clinical conditions. Varicella cause chickenpox. Zoster causes shingles. Zoster ophthalmicus. Keratoconus. It is ectatic dystrophy of the cornea characterized by central stromal thinning leading to forward bulging of central or paracentral cornea, or it is a progressive disorder in which central or paracentral corneal stromal thinning occurs, accompanied by apical protrusion and irregular astigmatism. Cornea look cone shape. Cataract. Opacification of crystalline lens of an eye. Ectopic lentis. Displacement of lens from its normal position. Glaucoma. Glaucoma is defined as progressive optic neuropathy with characteristic visual field defects. Raised intraocular pressure is one of the major risk factors. OR. It is a clinical condition characterized by intraocular pressure sufficient to produce optic nerve head fibers. Damaged cupping resulting into visual field defects. Congenital glaucoma. It is a glaucoma which is caused by impaired aqueous outflow due to maldevelopment of the anterior chamber. Angle trabeculodyskinesis. It is the term used for the glaucoma, which meets the following criteria. I. Angle anomaly present at birth. E. Elevated IOP during the first of life. No associated anomalies of the eye or adnexa. Ophthalmos enlarge eyeball loconox eye. Increase corneal diameter. 12 mm or more. Anterior Uveritis. It is the acute inflammation of iris and ciliary body. There is present keratic precipitate in anterior chamber. Acus flare allow present which is collection of protein in anterior chamber. Subconjunctival hemorrhage. Corneal foreign body. Conjunctival foreign body. Diabetic retinopathy. In right picture. Boat-shaped subhyaloid hemorrhage. In left picture cotton wool spots. Retinal artery occlusion. Whitish appearance of retina. Cherry red spot is present. Retinal vein occlusion. Hemorrhage all over the retina. Disc edema. Enlarged veins. Retinal detachment. It is the separation of sensory retina from retinal pigmented epithelium by subretinal fluid. Retinitis pigmentosa. Slowly progressive pigmentary retinal dystrophy predominantly affecting rods more than the cones. There is waxy appearance of disc. Pigmentary bone corpuscles or spicules. Maculopathy. Retinoblastoma. It is the congenital malignant tumor arising from primitive retinal cells of sensory retina. It has 4 stages. Quiescent stage. Inflammatory glaucomatous stage. Extraocular extension stage. Metastasis stage. Thyroid eye disease. Autoimmune inflammatory disorder. Clinical sign. Dalrymple sign. Retraction of upper eyelid in primary position. Kocher sign. Staring and frightened appearance. Von Graeff's sign. Lid lag. Stellwag's sign. Infrequent blinking. Squint. The misalignment of visual axis of 2 eyes. In this picture there is left eye esotropia because it is moving inward. In this there is left eye exotropia as it moves outside. This is picture of amblyopia and one eye is occluded for treatment.